During blood transfusion, the most important nursing responsibility is A. Take a sample before each transfusion. B. Maintain patency of line with NS. C. Warm the blood to prevent chilling. D. Start the blood transfusion at the slow rate during the first few minutes. And the right answer is D. Start the blood transfusion at a slow rate during the first few minutes. Close observation should be done for the first 5 to 15 minutes following blood transfusion. Observe the patient for sign and symptom of transfusion reaction. A priority nursing intervention for a patient during a immediate post-operative period is A. Observe for hemorrhage. B. Maintaining a patent airway. C. Recording the intake and output. D. Checking the vital sign every 15 minutes. And the right answer is B. Maintaining a patent airway. Maintaining airway is the most important priority always. At what time nurse assess the gait of an ambulatory patient? A. After the neurological assessment. B. At the end of the physical examination. C. While the patient is lying on the bed. D. When the patient walks into the room. And the right answer is D. When the patient walks into the room. What should be added to normal saline solution which is connected to arterial line measuring blood pressure? A. Protamine. B. Calcium. C. Potassium. D. Heparin. And the right answer is D. Heparin. Heparinized saline solution is used to prevent occlusion in the arterial catheters and CVP monitoring catheters. Heparin works by disrupting the formation of blood clots in the veins and arteries. What do you mean by dysphagia? A. Difficulty in breathing. B. Difficulty in voiding. C. Difficulty in swallowing. D. Difficulty in speaking. And the right answer is C. Difficulty in swallowing. Difficulty in breathing is known as dyspnea. Difficulty in voiding is known as urinary hesitancy. Difficulty in swallowing is known as dysphagia. And difficulty in speaking is known as dysarthria. Sudden redness of the skin is termed as A. Flush. B. Jaundice. C. Cyanosis. D. Pallor. And the right answer is A. Flush. Flushing happens as a result of increased blood flow to an area of skin. Flushed skin is a common physical response to anxiety, stress, embarrassment, anger, or another extreme emotional state. A term used for normal respiratory rhythm and depth in a client is A. Eupnea. B. Apnea. C. Bradypnea. D. Tachypnea. And the right answer is A. Eupnea. Eupnea is normal, good and unlabored breathing. Apnea is the cessation of breathing. Bradypnea is abnormally slow breathing and tachypnea is abnormally rapid breathing.